Welcome to Public Health Matters, the show that addresses public health issues that matter the most to the citizens of Harford County. Real issues, real people, and the information you need to know.
Hello, I'm Rania Nassar, Public Information Officer for the Harford County Health Department, and your host for today's Public Health Matters, the show that takes a closer look at the public health issues that matter the most to the citizens of Harford County. Today's topics revolve around sexual assault and domestic violence and may be sensitive for some people to hear. If you are experiencing a reaction to the content we discuss, please feel free to reach out to SARC's 24-hour help hotline at 410-836-8430. We'll be talking about sexual assault today in order to raise awareness of these issues and the help that is available. Joining us today is Development Director for SARC, Neela Lancelotti, and Allison Imhoff, Director of Counseling and Client Services for SARC. Welcome to our show, and thank you so much for being with me today.
Thank you for having us.
So, really excited to speak with you. Can you guys just take a quick second to let me know, who you are, introduce yourselves?
Sure. My name is Neela Lancelotti. I'm the Development Director at SARC, and I've been with the agency for about 5 years.
And I'm Allison Imhoff. I'm the Director of Counseling and Client Services, and I've been with the agency for about 4 years.
Great. So can you both just tell me a little bit about SARC? What does it stand for?
Sure. So it stands for the Sexual Assault Spouse Abuse Resource Center, and we've been in Harford County since about 1978.
Wow. So you guys have been here for a long time now.
We have, yeah. It started off as very much a grassroots organization, volunteer-based, to address a need in the community, and from there has grown to be what we are today as a victim service agency.
And we're grateful that you guys are both here. What population do you guys serve in Harford County, and what percentage of the population will experience sexual assault in their lifetime?
So every year, SARC actually services about 2,000 people in and around Harford County. We provide safe house services for people who actually need to go into hiding from their abuser. We provide counseling and crisis services for people who just kind of need to process through what they've gone through, what they're going through, help them problem solve different aspects of their lives to ensure safety. And we also provide legal services, which provides protective orders, custody cases, divorce cases, and we also have an immigration attorney on staff.
Oh wow, you guys do a lot, and I'm sure that a lot of the citizens don't know that as well. And then, so other services that you do provide at SARC that people may not know about?
So as Alice was saying, we have a wide range of services. So we have a clinical department for counseling for children and adults. We have our legal department, which provides representation and advocacy. We have an emergency shelter, a 28-bed emergency shelter, and that's really for victims that are in imminent danger and in highly lethal situations. And then we have a variety of victim services, so anything ranging from case management to a food and hygiene pantry, a housing advocate, life skills advocate, and those are victim focused. And we also have an abuser intervention program for perpetrators.
We also have a human trafficking navigator here in Harford County as well.
So I want to kind of just delve a little bit into, what is sexual assault, domestic violence, things like that. Who would be looking for these services?
So honestly, anybody who is actually in sexual assault, who has experienced sexual assault, who has experienced domestic violence, we obviously work with people who are trying to flee from those situations, but we also work with people who've experienced some kind of abuse at a different time in their lives. And they finally hit a point in their life where they're ready to either process or pursue other legal avenues. Sexual assault is anybody who has, it's a range of assaults. Obviously it can be molestation, all the way to rape. Domestic violence, a lot of people just think of physical violence, but what they don't think about is the emotional abuse, and a lot of the times the financial abuse that goes against these survivors. So we work with the survivors to try to help them rebuild their lives.
So we've experienced the pandemic, not just here in Harford County, not just America, the entire world. And it's affected a lot of health issues everywhere. And if you guys could just go a little bit into what that impact of the pandemic has, done for domestic violence, and how have you guys helped navigate through what we're experiencing today?
I think at the very beginning of the pandemic, one of our main goals was making sure that the community and victims knew that SARC was open. With things closing, shutting down, and where you're self-isolating, I think that created an additional challenge for victims of intimate partner violence living with their abusers and not having the same opportunity to go into the office or to get their hair cut or go into a grocery store necessarily. So I think we really wanted to make sure that it was known that SARC is an essential service, so that if you needed help, we were there for you to reach out, whether it's through our helpline. We developed an online chat system, just trying to figure out a different way for victims to reach out safely, especially during a time when, again, self-isolating and remaining at home was a safeguard for the pandemic. I think for victims of intimate partner violence, it created another challenge. And so we wanted to just make sure that they were aware that as things were closed and things were shutting down, that our services were there should they need some help and support.
We've also made sure that a lot of our services are actually online now. So we moved all of our counseling services to be fully telehealth, which has cut down on a significant number of barriers for a lot of our clients.
That's great. Can you guys go a little bit into, what is intimate partner violence, or IPV, and what approach has SARC taken when working with victims of intimate partner violence?
Sure. So intimate partner violence, it's kind of a taboo term at times, because a lot of especially for our sexual assault survivors, they're not in a committed relationship with their assailants or their abusers. But unfortunately, the term intimate partner violence is anyone who has been intimate with someone else. So it might not be their current spouse or boyfriend or girlfriend. It could be an ex. It could be someone that they met at a party who sexually assaulted them. So intimate partner violence actually just kind of encapsulates a whole bunch of different types of relationships. It could be someone you just met or someone you've been in a committed relationship with for decades.
And I think a lot of people might not truly think that they might be in a situation with someone who they might consider it intimate partner violence, but you guys are there to kind of help, assure them that they are, everything that they're feeling is valid, I'm sure.
Yeah, absolutely.
So SARC does have a sex trafficking navigator. Can you just just a little bit elaborate onto that position and what you guys do with that?
Sure. So anyone who's been in Harford County knows that we have the 95 corridor that comes straight through our county. And with that being said, we're fully aware of the increase in human trafficking that has occurred along that corridor. So the human trafficking navigator actually works with local law enforcement, DSS, the school systems, the hospitals. We even have a memorandum of agreement with Aberdeen Proving Grounds to ensure that anyone who is either at risk for human trafficking or sex trafficking specifically, or has experienced it, has someone who can connect them directly with resources. Our human trafficking navigator and the vast majority of our team has been significantly trained in red flags, how to intervene, how to safely get them into a better situation. And we have a human trafficking task force that we're very proud of. We actually host it quarterly. And we have people from anywhere from the state's attorney's office to DSS to SARC to Maryland State Police Child Recovery Unit sitting around the table.
Wow. What would you say are the signs of domestic abuse, and what would we need to look for if we have a friend or a family member who might be experiencing it? How can we pick that out if we are just having a normal conversation with them?
Sure. So the first thing is isolation.
Okay.
And that could be anything from physical isolation to social media isolation to when they're out and their significant other just gives them a look and their demeanor changes. Basically, people who are trying to control others will try to limit any kind of social interaction where other people can realize that something is wrong. We have a lot of clients who their abusers have moved them across the country to further isolate them.
Wow.
A lot of the times, if there's a history of animal cruelty, that's actually one of the major red flags, because people who have abused animals in the past are far more likely to abuse humans.
Oh.
As well as, the physical signs, someone who fell down the stairs, or, oh, well, I'm just so clumsy, I'm just always hurting, I'm getting hurt all the time. Someone who doesn't have control over their money because their abuser has told them that they're just not good at it. Frequent moves, any of those things are good red flags, just to ask someone, is everything okay? Chances are is they're going to say yes, but if you continue to acknowledge that, look, I'm just here to support you, I'm here if you need anything, that's the best way to proceed.
And I'm sure, is it easy to kind of pick up those signs? And
yes and no.
Okay.
It really just depends. So we live in a county that, a lot of people move here from other areas for job opportunities and things like that. Sometimes it's easy to pick up on the signs if you are connecting all the dots, but sometimes they're easy to look past, especially for people who've been in long-term relationships or have a lot of kids, and they're just saying, oh, I'm just always so busy with the kids and things like that. The pandemic has changed a lot of things for employment and household stress. And with that being said, a lot of things have changed, so the red flags will often change too.
Is there a cost associated with any of the services that you guys offer? I know sometimes people might feel a little apprehensive if, they probably have an abuser who maybe controls their money, so they don't think that they're able to get the help that they might need.
Yeah. Fortunately, we're able to offer our services for victims. The counseling, the legal, our shelter, case management are all free.
Oh, that's amazing.
And yeah, absolutely, because as Allison was saying, financially, it can be a huge burden. It can also be a safety issue with insurance. So we're really fortunate that all of those services for victims and secondary victims are free of charge. Our abuser intervention program is our only program that does have a sliding scale fee.
Okay.
But like I said, for counseling, shelter, legal advocacy, just calling the helpline just to get some information, which a lot of times is the first way people get connected, is free.
That's amazing. I'm sure that breaks down a huge barrier to a lot of people that might be experiencing this. How can someone get in touch if they're experiencing any type of abuse? How would they be able to get in touch, especially again if they're maybe in a relationship where they can't do so much?
Sure. So we have a 24-hour, 7 days a week, 365 holidays, weekends, 2 o'clock in the morning, 2 o'clock in the afternoon helpline. The helpline is 410-836-8430. We also have an online text chat just in case it's just not safe to make a phone call. We also have a website, and for anybody who goes to our website, there is a button that helps you get off the website very quickly for safety reasons. But their helpline is the best thing, because you can get connected with someone who is trained in trauma-informed care and can safety plan with you immediately.
And can you help with someone who might need to take legal action for any of the help that they receive, or any action that they legal action they might have to take towards their abuser?
Yeah, that's our legal department helps with divorce, custody, immigration, protective orders, and so I think it's a really useful. All of our services are really important, and the legal angle can be very complicated and what your options are. So when someone calls through for the helpline or the chat, we can connect them with the legal department so they can get directly to someone to ask those specific questions and get accurate information and resources to find out what their options are.
And so I want to talk a little bit kind of about the disparities between sexual abuse. Sometimes we automatically think it might be just females that experience sexual abuse. Is there also male abuse too as well? I just kind of want to go into that. How often is it maybe a male abuser, a female abuser?
Sure.
We can go into
So
that.
the vast majority of our clients are females. However, we service a good portion of male survivors every year as well. We also service transgender people, and we treat them how they identify. We have abusers who in heterosexual relationships and same gender relationships as well. And with that being said, a lot of people think it's taboo to think of females as the aggressor. In my personal experience in working with these survivors, female abusers have shown to be more likely to threaten murder-suicide and to use weapons earlier on in the abuse. They will also threaten to take the children away and things along those lines. So even if someone's physical stature is smaller than their survivor, it doesn't make them any less dangerous.
That's interesting because I think it's also, how the media plays into what we also see as sexual abuse, and sometimes it's different than what we see portrayed on the TV. What would you say to someone who is experiencing domestic abuse, sexual violence, intimate partner violence? What would you say to that person, and how could we, talk to them in a way that could help them get the help that they need?
I think one of the first things is, I think letting them know that you believe them and that you're listening to them. I think it takes a lot of courage for someone to share information and to say that they need help. And that's a really big first step. And there's a lot of complications that happen if someone, if in a relationship with their kids, their house. And so I think just thanking someone and letting them know that you believe them is a huge first step. I know for a big part of SARC that's really important, it's referrals and letting people know that there are resources. I think initially not knowing where to go or who to turn to for help can be a barrier. So the more people that are aware of resources can refer them to our website, to our helpline, and let them know that there is someone there who can provide some help. I think it's a really big step.
I think for even people who may not find themselves in an intimate partner violence situation, just having the general knowledge of who's around, who's local, how fast can someone get help, because you never know when someone's going to present to you and say, I need something. So just kind of having the general knowledge of what's available is one of the best tools that we can teach our community.
And how hard is it for someone to actually come to you guys? Does it take like a while? Is this something that you'd think that if someone's experiencing any type of assault that they're gonna want to go get help right away. But what usually is there like a timeline that people are usually take when they're experiencing assault to kind of search for help?
We've had people just do walk-ins, and as soon as you walk in through our door, you're not going to leave without services.
Okay.
We've also had law enforcement who reach out to us, and they will basically drive a survivor to our administrative office, and from there we move them to safety. So I've seen us be able to service a survivor in under 20 minutes.
Oh wow.
Sometimes a lot of survivors, they reach out, but they're not ready.
Okay.
And that's okay. So sometimes it takes them weeks, sometimes it takes them months, sometimes they'll call back around the same time each year. Research shows that a survivor will try to leave their abuser 7 times before they finally do.
Wow.
So there are times where the survivor might reach out and they'll get a little bit more information, but they're not ready to leave yet. And then they'll reach back out and get a little bit more information, but they're still not ready to leave yet. And sometimes it just takes for that one situation to occur, or for them to have gathered enough resources to feel comfortable to leave.
And I'm sure it's probably very comforting to know that, when they do reach out for help, that you are able to help them right away. So there's that comforting, moment at least, so they know that once they're out, then they can breathe for once.
I think so.
And so what would you say to families who don't really know how to help if they have, whether it's a child, a brother, a sister, that kind of need that kind of push, that they are experiencing this and that they do need help, and maybe their families can only help so much into the situation too as well.
Right. I think one thing that's really important too is that intimate partner violence looks different for everyone. And so sometimes it's easier to pick up on signs and other times it's not. So I think one of the first steps is always, letting them know that you believe them. But I think for our services too, we can help navigate how you can talk to someone and make them aware of what help's available and also what a healthy relationship looks like. I think that's a really important thing. We have a community outreach and education department. We have services once someone is a victim and needs those services, whether it's an attorney or counseling or shelter. But prevention's really important in doing education and trying to talk to all different ages, different businesses, organizations about what actually is a healthy relationship and what it's built on respect and trust. And so I think that's an important component to be able to know what that looks like as well.
What it could be like signs of that healthy relationship that we want to make sure if we're talking to our friends and they're talking to us about, their relationship with their significant other?
Sure. Yeah. A healthy relationship is where each party feels comfortable disagreeing with the other without fear of retaliation of some kind, where they're equally respected in their dynamic and where they each feel that they are contributing and that neither one of them feels that they are the cause of all of the household struggles. So being able to freely be yourself without fear of retaliation is the primary key to a healthy relationship.
That's great. And what other resources do we have for sexual assault, domestic violence, either in Harford County, the state of Maryland, that other people should know about?
Maryland Network Against Domestic Violence, and there's the Maryland Coalition Against Sexual Assault. Various counties have their own rape crisis or domestic violence agency. So I think those are great resources for the state of Maryland if you're looking of what's local in your area, of where you can reach out and get some help and resources. Specifically for Harford County, we have SARC and our helpline number, but there's the national network as well, since it depends on where you might be living. That's the safest place also for you to get resources.
Is there anything else that you both would like to add, mention about SARC that the citizens of Harford County would really benefit from?
I think just the reminder that we're available 24/7, 365, any time of the day or night. We understand that a lot of people might not be able to reach out when their abuser is present. So reaching out to local law enforcement, your local school, DSS, any of those things is perfectly fine. They will find a way to get you connected with us, and that anyone who is experiencing this, it's not their fault, and that there are services available to make sure that they end up in a safer space.
And so, again, before we do close today, I do want to talk about how, again, this was such an important topic to talk about today, and it's a tough topic to talk about, and sometimes it's, people don't want to talk about it, but we all understand that this is really important for, just to having a casual conversation with people to kind of break down those barriers so that it's not taboo. So I appreciate both of you, and I really think this was a really important topic and that more people do need to talk about it more to their friends, their families. So I thank you both.
Thank you.
Thank you so much for having us.
Well, that's all the time we have for today, and I'd like to thank my guests on today's show, Neela and Allison. If you'd like more information on SARC or sexual assault or spouse abuse resources, please refer to the resources page right after the show. And join us next time for another important health issue that matters the most to the citizens of Harford County. Thanks for watching.